I was asked to talk about the Birmingham context, and I think while I was on the train on the way here, I noticed a tweet saying that the DCS in Manchester had resigned because of the Ofsted report. And I think that people might have heard me talk about this before, I think that the Ofsted is definitely making the patients sicker. And I don't know what we're going to do about it. I think that the current situation that Birmingham finds itself in worsened after the 2012 Ofsted report. And I think that that was partly to do with the incumbent director doing a bit of a new broom thing and saying all this other stuff that happened before was wrong, and now we're going to do it differently. And so we had reorganisations into teams of 25 social workers, and I'm completely with Julian Legrand on this one, that is not a very good idea. You need to have people in small units with proper communication, very unpopular with the staff. And also during that period, an awful lot of very good, well-established, competent senior managers either left, were encouraged to leave, or something, Birmingham. So you've now got a lot of interim people who I'm sure are very good, but don't have the history of understanding how Birmingham got to be in the position that it's in. So one of the things is we've got to disambiguate a few things, because Ofsted's there whether things are privatised or not. The issue about what happens if things are contracted out of the local authority and Ofsted's role in that is a tricky one, because they're saying that these entities won't have to register with Ofsted. So I find myself in an unusually ambivalent relationship with Ofsted on that particular issue, because maybe something's better than nothing. Now, this is complicated, because when you look at other jurisdictions, there is actually no precedent anywhere for anything other than the state to do the investigatory role in child protection. It doesn't happen in Florida, it doesn't happen in Kansas, and they're the two kind of big examples of large-scale contracting out. The picture of what happens if you look at those empirical cases, it doesn't save any money. In fact, in the initial years, it costs a lot more money. There are some indications that some outcomes improve, but we have to look at whether that needed to happen, whether it's the actual change in the governance structures, or whether it's actually something to do with what Helga was talking about the conditions in which people are working and what sort of caseloads they've got. So, where am I going now? Lots of things go wrong systemically, and at the moment you've got Norman Warner operating as the Commissioner, and I have to say I don't see any signs that he's particularly keen on establishing a trust or contracting things out. He seems to be saying some quite sensible things to me about trying to have smaller teams, trying to establish more stable workforce. There's a huge problem across the whole system with agency staff, and how you actually reverse that. Because it's actually quite hard for people who've started working for agencies to stop, because the agencies pay so well. It's very difficult for people to cope with going back to a local authority salary once they've had an agency salary. And because of all the turbulence in the system, which is certainly exacerbated by the inspectorial regime, or the ethics, or the absence of ethics of inspection at the moment, people are reluctant to commit themselves to work in a local authority on a permanent post. So these are all things that actually exist within the state system, which do need fixing. I mean, I do think Helga's right. We do need to do something about this. And some of us have been banging on about it for a while, and Helga and I were on the task force years ago, and we're banging on about it then, and here we are again, and it's not any better. So it's very, very difficult to fix, because when things go wrong, people just keep doing the wrong thing righter. So if inspection hadn't worked, then what we need is more of it. And we keep hearing tougher inspection. Well, if you use that as an analogy for how people work with families, that's not what we want. We don't want people being tough. We want people being compassionate and wise and rigorous and all those sorts of things. But we don't want people going in, right, here we are to give you the stamp of inadequacy. And of course, you've then got a load more turbulence in the system with some extremely good interim managers, but they're very expensive. And these things are a hell of a difficult thing to turn round. So when we wrote the letter to the Guardian, what we were calling for really is a pause and a proper debate about this. I mean, I don't have a problem with different governance structures for children's social care, as long as there is democratic accountability and it's not for profit. I don't have a problem with the team that are in Doncaster. I think that they've got some extremely good, experienced managers there. But I do think that Alan has identified something that is concerning, in the sense that that's okay now, but will it be okay in years to come? There is it's not really spoken, but there is a notion, I think, that local authorities can't keep children safe. And this is obviously not true. And there are also some notions that social work education is broken, often peddled by the same people who are saying that local authorities can't keep children safe. So there's a whole lot of stuff going on nationally, which is very clear, but somehow not quite articulated. The deregulation bill, which is ushering forth these opportunities, is a very peculiar thing, because it's talking about deregulating all sorts of things. For example, the sellers of knitting yarn, pigsties, a whole variety of things are in this bill. And so this is not getting proper parliamentary scrutiny. And as I say, we're on the verge of doing something that hasn't been done anywhere else in the world, which is contracting out this state role of intervening in the private spaces of families and potentially removing children or leaving them in situations of risk. Even the probation service, which, my God, is being hollowed out big time, has kept the National Probation Service for serious offenders. That's going to be incredibly stretched, because the community rehabilitation companies, I think they're called, are allowed to chuck back into the National Probation Service things that they think are too risky. Now, that is what's going to happen in child protection, because I don't actually think necessarily the investigative function is such a thrilling business opportunity. So that's likely to remain in the state control, while resources, and this is what has happened in parts of the states, the resources start to shift into these provider organisations, of which I have to say that we have to look at how much privatisation there is already. I mean, Helga's mentioned the issue of the NHS, and we have got this peculiar enchantment with particular versions of commissioning and particular versions of evidence about what can be commissioned and when outcomes should be measured and who decides what those outcomes are. I mean, I listened to a surreal programme about an initiative in Staffordshire about contracting out the cancer services. Did anybody hear it? Well, I've never heard such a baffling load of nonsense from the person who was writing this brief. Because what he was talking about is that the cancer services have become so fragmented. Hey, yeah, because you've contracted a lot of them out, they're so fragmented that actually we need a contract to coordinate the fragmented services, which is going to be worth, millions or billions or whatever. And the process of producing these tenders themselves costs a lot of money. So you've got this endless churn. And I mean, I just have to read you this, because I mean, obviously I was on my phone on the way here, and this came through, which is a conference, Achieving Outcomes for Children, Evaluation, Evidence and Impacts. And I'll just read you a few of the headings. How to use evidence to achieve more with less. What counts as a good intervention with children and young people's services? The Early Intervention Foundation approach to outcomes, evidence and evaluation, what it means to be a what works centre, blah, 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 connecting with the business community to boost your impact. I mean, God almighty, what kind of nonsense is that? And how much money does that cost? And you've got some of the large charities involved in this as well. So what you're getting is a lot of money being siphoned off into franchise parenting programmes, often not from the UK. So what we're losing is the ability to fund and concentrate on sustainable, community-based, locally designed solutions. What Birmingham needs to be doing at the moment, and hopefully, obviously the about-to-be director has not come. So we've now got another one, and hopefully she will start by having conversations with staff and with families who know the city, and not do anything for a bit, apart from perhaps make the teams smaller. Because what we need is somebody to come and have a look and hang around and do a bit of anthropology and do a bit of ethnography and find out what works and help the social workers. There's a lot of wisdom around in social services in Birmingham, and it hasn't been utilised. Well, it has by some of the managers, but they're interim and they don't stay, and it's a problem. But I do think we have to be honest about the fact that local government, the corporate system in local government hasn't been very helpful to social work either. So we've got the disastrous integrated children system, which I won't go on about because I've been going on about it for about the last 6 years and I'm tired of it, but it's still here. We've got call centres, we've got agile or fragile working, as I call it, and all of these things have come from the corporate centre. And I hear these phrases, we need a corporate front door. Why do you need a corporate front door? I mean, why? And where does that language come from? Well, that language comes from business. And it's imported into public services through new public management. So rather than local authorities being unable to keep children safe, maybe we need to resurrect a language which is much more communitarian, much more about local democracy, and much more about people in communities making their own decisions about what they want. Doesn't mean that the hard decisions about hard choices, oh God, no, don't go there. The hard decisions about some children not being able to live safely in their families, we've still got to make those decisions. But the vast majority of children and families that come to the attention of services need a family support service that is sustainable. And there are examples of this from the States, from the UK. There's an initiative in New York, and there's a book called From Pariahs to Partners, where they worked with women who had lost children into the care system, and they worked as advocates and peer mentors for women who were at risk of the same thing happening with them and their children, and it works really well. And just finally, this notion that you cannot reform from within a local authority is not borne out. I mean, we keep hearing about the Hackney model, and it was a successful innovation within a local authority. Alan Wood is championing privatisation and contracting out, but in his very own authority, 2 brave managers did this without going anywhere else. So it is perfectly clear that with the right support, and obviously he gave it, people are able to change and reorganise the way they work. But we have to get rid of nonsense management fads. These things don't work. They are completely inappropriate for social work and children's social care. I think I could go on and on about the Heckman equation and all sorts of outcome indicators, but I think I've made my point.